Hello everyone, I am Dr. Sushrut Kamoji, qualified skin specialist practicing at Spurs Skin, Hair and Laser Clinic for the last 12 years at Belgaum, Karnataka. Today I will be talking about laser hair reduction and the technologies available with regard to this particular aspect. Laser hair removal or hair reduction has been a very hot topic for a very long time. A lot of people conceive that this is a permanent remedy. They feel once they have undergone laser, it's permanently gone and they will never grow it back. So let me first start with a few things such as the technologies available for laser hair reduction. The earliest technology which was available was electrolysis, which is still in use, but it is used mainly for reduction or removal of white hair only, because the chances of scarring with electrolysis are immense. Later on, we had the technology called IPL, which is intense pulse light, which required numerous settings and the reduction was not up to the mark. With evolution of the technology, this technology also improvised and led to what is known as long pulse NDI. Following long pulse NDI, we had diode hair reduction, and currently the most happening technology in the field of laser hair reduction is alexandrite laser. How the technologies have evolved over a period of time is very interesting, but what ultimately matters is how much efficacious these lasers are. Today I will be speaking on alexandrite laser, which is the new kid in the town and has fantastic results with very little side effects. So today I will be speaking on the contrasting features between diode and long pulse NDI. Having said that, I would like to emphasize I have been using long pulse NDI for more than 1 year now, and prior to that I had used diode for nearly 3 or 4 years. The major difference between diode laser and the long pulse NDI is the adequacy of the dose. With long pulse NDI, we have a very clear picture on whether the laser energy which was delivered is adequate or inadequate. Diode is a blind procedure, however long pulse NDI is not. With long pulse NDI, every shot that is fired clearly indicates whether the hair is burnt or not burnt. So then and there you understand whether the procedure is done or whether it needs another shot or whether it needs another pass. Similarly, the other features are with regard to the redness. The redness with diode laser is much more, especially if it is a cold tip diode. Initially, we do not realize the erythema, we do not realize the possibility of burns because the cold tip is preventing it. But maybe sometimes a day or 2 days later, the patient comes back with burns or superficial blistering also. Diode needs a lot of care. It requires utmost diligence while doing the procedure. Aesthetician who is not trained enough in diode may actually give disastrous results. However, with long pulse NDI or the alexandrite laser, which I am currently using, these chances are next to none, because you start with very minimal dose, and whatever dose burns the hair, you stick to that. If you feel it is inadequate, you can again increase the dose and fire on that particular hair itself. Coming to the results wise, because we do not understand the adequacy of the energy in diode, definitely it is bound to give lesser results. What was my experience is about 50 to 60% reduction of hair in about 6 settings with diode laser. However, the same thing is nearly 70 or 80% with alexandrite laser. Having said this, whatever I am talking about is only for the facial hair. When it comes to body hair, the numbers are completely different, and the results of the facial hair also definitely depend on the levels of the hormones. So I will try to give you a brief overview on what the advantages of long pulse NDI against diode. I have been using long pulse NDI since 2013. I used it for more than 6 or 7 years and the results were fantastic. It is far better than diode. Since diode was the in thing, after Long Pulse India, I switched to diode. I used it barely for 2 years, but I was certainly not happy with diode because there were a lot of disadvantages. In quest for a better machine of Long Pulse India, I was trying to pull on with diode for nearly 2 years. And when they launched this particular machine, which is a combination of Long Pulse India with Alexandrite, I bought it the same day. Today I'll be telling you what are the settings that I use for Long Pulse India and how this is much better than diode. Diode has a much longer downtime with regard to the hair reduction. It requires many more settings compared to Long Pulse India. So now I will be briefing on what settings I've been using with this machine. So this is the latest laser hair reduction machine, which is a combination of Long Pulse India as well as Alexandrite. So you can see both the modes are available. Long Pulse India shows good results when it comes to thick hair, and Alexandrite shows good results when it comes to thinner or finer hair. However, I always use these modes individualized or customized for each patient because it is not a universal law. Now in the Long Pulse India mode, I start off with a basic energy of 15 joules. This is a frequency, no need to change with the pulse width because this is already pre-customized. Frequency just determines how fast you want to do the laser. So once you're with 15 joules, just set the machine on to ready and we are good to go. So the laser is quite simple, point and shoot. Now you see this is an inadequate energy, but you can still see that the hair is being vaporized. You can see the flames coming up over there. And if you feel you want even faster results, you can slightly increase the energy and go a little higher. If you see the hair, the area which I have already done the laser, you will be able to see the singed hair. This is at a bare minimum of 15 joules. Now in case I want quicker results, I can go a little higher. I will go up to 20 joules now, and you can see how this goes. And the patient is also quite comfortable. There's hardly any pain. It's a very fast procedure. The hair is vaporized as and how we are doing it. Unlike diode, where we do not completion of the laser, here it's just like that at the click of a hand, and you can see the hair is gone. So the areas where the hair is left out, a second pass can be taken up. However, most cases, once the energy has been set and it has been finalized, they respond to just one single pass, and you can see there is hardly any erythema, hardly any frosting, and the hair is gone. So I will demonstrating laser hair reduction with the Long Pulse India mode right now. It is very simple, very easy. Many of the times they don't even require anesthesia. Simple cooling is also sufficient. Just point at the affected area. Many a times it doesn't even require trimming of the hair until and unless it is very thick or very dense hair. Point at the area, shoot. That's it. You can see the flames coming off, the hair getting vaporized, and the patient is also quite comfortable. Most of the times it is a single pass technique and the hair is burnt. The post-procedure care for laser hair reduction is like any other laser. However, it is much more simpler since it is quite targeted and the collateral damage is much lesser. A simple mometasone cream for 2 to 3 days suffices most of the times. There is not much of a downtime unless and until a lot of area like the entire hands or back is done. I do not advise any additional things. Only if it is large area, I advise them a moisturizer, a sunscreen, and ask them to abstain from taking a hot water shower for 3 to 5 days.